Ratnesh Kaushik, a 35-year-old IT professional in Bangalore, went for food last night, and today morning he had severe health complications and he was admitted in a hospital. The senior doctors there did the blood test and found out that there were constituents of bromodiolone, a rat kill poison, in his blood. When they asked him did he consume any kind of rat kill poison, he denied, but soon after he fainted as well. He was on critical life support, and at the same time his organs started failing. Now doctors started treating him symptomatically, but they also were worried why exactly a healthy person's blood has bromodiolone in such high quantity. Followed by that, in isolated hospitals in the same locality, similar bromodiolone patients were admitted, but none of the doctors were connected to each other, so they didn't knew. Case of food poisoning where probably by mistake the rat kill poison has got mixed with food in some of the restaurant. When the investigations happened, after 7 days they realized that it was one particular restaurant where by mistake the rat kill poison got mixed up with the dough, and that led to all of this. Now the reason I'm talking about Ratnesh and various such cases which happens in our locality, in our country, is because there is an absence of data centralization. Forget AI. Now on one hand, when the patients are walking into a doctor's dispensary as of today, and if they start citing Google or ChatGPT, doctors get angry because of course that is incomplete information and many times overly exaggerated information. But at the same time, our doctors are treating our patients based on symptoms, not on the basis of data. Now at the same time, one particular doctor might be having a different approach to the same poisoning, or the other doctor might have a different approach. But in the case where we can integrate data, we can analyze data on a large scale, then we can predict the patient outcome much more efficiently. Now the case of this Ratnesh food poisoning was just one isolated case, but there are various other things where AI can be used. So in today's video, I'm going to talk about why every healthcare professional, that means doctors, clinicians, should learn AI/ML in healthcare. What are the benefits, what are the shortcomings, and how AI is already infiltrating in our fraternity, and how can we further utilize to make our processes much more efficient. Now having said that, there are caveats. I'm not saying that AI is perfect, but there will always be a human in the loop or a doctor in the loop which will be required when it comes to patients. But if AI can accelerate our way of treating, we should use it, of course, with caution. So let us talk about what are the benefits of learning AI/ML in healthcare. Now, first things first, I want to make it very, very clear. AI/ML in healthcare does not mean that you have to learn coding. You're going to learn how to use AI tools in your healthcare setup. However, if you can learn coding also, then you can design your own algorithm. That will come a little later. So let us start by talking about today's system. So today's healthcare setup is about experience, not focused on outcome, not focused on data intelligence. And that is where AI comes into picture. So like I said, if there is data available also, let's say that 1,000 hospitals in Bangalore today reported cases of food poisoning, or reported cases of cancer, or reported cases of COVID. So in the absence of data integration, we don't know that. Even if data integration is there, the problem will be nobody has the time to analyze that data, and that is where AI comes into picture. It will be important to read millions of patient records. Now who has time for that? AI can do that. It can detect patterns invisible to the human eye, and it can predict the disease risk even before the symptoms appear. And that is where we are now moving from a healthcare system where it is all about experience to outcome, from outcome to intelligence, and that is where AI will be helpful. So as a clinician, you should learn AI. Before your patients learn, you should learn. Now, the second thing I would like to highlight here today is AI is making clinical decisions for doctors, and how doctors can take it with a pinch of salt. Okay, so let's look at radiology. We have X-ray, CT scans, interpretation happening through AI. Pathology, where digital slides and cancer grading can be done. Cardiology, where ECG and EEG interpretation is happening through AI. Oncology, where therapy selection is happening through AI. And ICU and ER, where sepsis prediction and triage is being predicted through AI. Now, a doctor who doesn't understand how this AI model works or how it learned the data, because many a times the patient data might have problems, and that is where the AI learned wrong things. So it might be interpreting wrong, right? So if you don't understand AI, you will adopt that, thinking that, okay, if the AI is saying it's right, but 99% times it may be wrong also, because the data on which it was fed, on which it was trained was wrong. Or maybe the data was from Britain and it is being applied in India, right? So different clinical setups, the outcome can be different. So that is where doctors need to learn how AI was trained, right? So unless you have a good understanding of AI, you cannot implement that, right? Now, next thing will be, we have seen a lot of diagnostic errors, and now this is not a fault of doctors. Many a times it is the absence of data or absence of collation of data, or somebody who's sitting with the data. It could be cognitive bias, it could be lack of information, timely information, or because there is time pressure and we can't wait for reports and the patient is dying, we have to act, right? So these kind of situations can be there. So AI will help you flag the missed doses. It will suggest different diagnosis or different patterns which has been seen in similar patients. It will highlight abnormal trends which might be there in this patient and which has not happened earlier, so that the doctor can look at the same patient from a third point of view, not first nor second, the third point of view. So that is where AI will help you develop better therapies for the patient. So a doctor who is trained on AI will know when to trust the AI, when not to trust the AI, when to override the AI, when to follow what AI is suggesting, and when to question the data. Right? So that is where it is very, very important for doctors to learn AI, ML and healthcare, because AI is definitely going to come. We cannot stop that. It's like, see, Google came. This is the Google era. Now we are moving to the ChatGPT era. So everywhere now, ChatGPT is infiltrating. So how the large language models work, how you can train or create your own AI model trained on your healthcare data, all of that you have to learn. Now, the next thing which I would like to highlight is, today we say this is a good doctor, that's a not so great doctor. Of course, people judge, even though we don't want to, but patients always judge, saying that no, this doctor is very good. I went there and I had a very good outcome. So basically, already patients have always been, judging the doctor based on outcome, even though the doctor is not responsible for the outcome. Many a times the therapy went right or wrong. There are a lot of caveats there, but today we are moving towards outcome-based treatment. Today we are moving towards preventive care and predictive care. For example, there is a prediction that by the age of 45, I am bound to get diabetes, so I have to postpone it. How long I can postpone? By now that there is a prediction, I'll take prevention. So I will avoid too much of sugar or too much of carbohydrate. So predictive and preventive healthcare is coming into picture. That is where doctors can implement AI to warn the patient or create apps which will warn the patient so that they don't fall into the trap of lifestyle diseases. And then coming to the population health management, we saw the benefit of that during COVID. What happened actually during COVID was actually mind-blowing. On one hand, we were seeing patients dying. On the other hand, we saw first-time data integration and how it impacted and helped doctors come up with better therapies, because everybody was collaborating. Every doctor in every clinic was looking at, okay, what therapy that guy used and it worked, what therapy they used, it worked, and that helped us create a faster preventive healthcare system. So doctors today can create apps which will create a local population health management system. Even that can be created by you, and that can be implemented so that all doctors are networked, all of them know, okay, what kind of sudden trend is happening in the population, and that whether this particular antibiotic is working, which one is working, which one is not working. what we should be doing, and that better network doctors powered by AI is the future of healthcare. Doctors can collaborate with AI to treat more patients. Doctor can collaborate with AI to make decisions faster and deliver better outcomes. However, I am again and again saying AI is going to be a multiplier of your effect, not something which we should blindly trust, because ultimately it is you who is going to be the decision maker. AI can just give you different point of view or angles to think upon. Okay, now let's look at another aspect which is very much human, and that is AI cannot build that trust which you have or the patients have on you. Building the patient trust, that's something AI can never do. Making ethical judgments whether to save an organ or the patient, you can make that, AI cannot. Handling uncertainty in life of patients compassionately, AI can never do that. And of course, as a doctor, you take legal responsibility when you are treating a patient. So of course, there also AI cannot. So what exactly AI can do is it can be a multiplier of your earnings as well as improvement in the healthcare outcomes. It can never be a threat, because ultimately you are going to be the decision maker. Now, there are certain specialties where AI is already there. Let me just quickly list out. We have radiology and imaging, we have pathology and lab medicine, we have oncology, cardiology, public health, clinical research and drug discovery and trials, where AI is already there. Now, because of this, new AI roles is emerging for doctors. For example, a physician AI collaborator, or a physician who can code AI, or a clinical AI reviewer, or an ethical consultant for AI, or a digital health lead, or medical AI advisor. So doctors who learn AI early will be able to shape those roles, and they will get higher paying jobs in medical companies, biotech companies, health tech companies, tech bio companies, India as well as abroad, because you have a medical degree, and of course you're certified to prescribe, plus you have very good understanding of AI. You can develop AI based algorithms. So that is where you can play an important role. Now, very soon, like in the next I think 13 to 14 months, you will see patients asking, are you using AI to treat me? Or people are going to ask, like the courts will ask, did you follow the AI protocols or not? Did you follow the ethical guidelines for AI or not? So regulators will ask for the AI guidelines, and this is where opportunity exists. See, money can be made when opportunity exists, and opportunity only exists when new things are coming. AI is going to, I can say, break or make healthcare. Right now we are at that juncture. So you could be that cement which will build the bridge in between AI and healthcare, and that is where you need to learn AI in healthcare. And that is where MediTechnika has an AI in healthcare and drug discovery training program, along with project where you can work on real world patient data, real world, develop algorithms for the patients and create apps. So all of that is coming on MediTechnika very soon. The announcement will happen. You can subscribe, and I'll let you know whenever that happens. So now coming back to one fear which doctors have is, see, I'm not an engineer, right? So I don't know how to code. So can I still work on AI? So let me give you 3 examples. The first example would be someone who can like say Microsoft Word or PowerPoint. So you don't code a PowerPoint, you make a PowerPoint, right? So PowerPoint is the tool you're making. So you are someone who is using the tool. So that can be one way of looking at AI in healthcare. Another could be you are the one who is building the tool, right? So person who is going to use the tool will also make money, and the person who will build the tool will actually earn a lot of money. So you can be both. If you want to build the tool, then only you need to learn coding, and if you don't want to build the tool, you want to use the tool, then you have to just learn AI ML in healthcare without coding. So having said that, of course you can write Python code with the help of AI. There's no doubt about it. I do. Everybody can do that. Then you can build neural networks. You can train models if you do that. But if you do not understand that part, no problem. You can just be AI literate, clinical intelligence literate, and you don't have to have the computer science degree or computer science skill set. What AI can do, cannot do, you need to understand that. You need to understand AI bias, accuracy, sensitivity, and specificity, validation of the model, whether it is trained on the right data, clinical safety and ethics, and regulatory frameworks surrounding AI. All of that you need to learn. Now, having said that, there are another aspect which I think I would like to highlight here. The world is moving towards personalized and precision medicine, right? So Preventive healthcare is something which wherein you can come into picture. You can utilize AI to create apps which can help in early disease detection, personalized treatment plans, genomics-based care, risk stratification, continuous patient monitoring using AI, and using, of course, CCTV plus AI. That's where you could come into picture. So there are multiple ways AI can be integrated or cemented into healthcare. But if it is cemented the wrong way, it is going to be hell for patients. But I'm sure doctors won't allow that to happen, because doctors are the first safeguards to the patient's life. So it is important to learn AI in healthcare, important to learn what are the tools available, important to implement those tools, important to understand how these tools can be used to make the patient's life better. So stay subscribed to MediTechnika. We are going to come up with a training program and a drug discovery course very, very soon for all of you. You can register for that. And of course, keep looking, because AI is going to revolutionize our world, and for good, right? So thank you so much for watching this video. See you soon in the next one. Till then, keep shining. Take care. Bye-bye.